By that smile, I'm sure you have a few stories.
Lots of stories.
Is there one that comes to mind that turned out to be a game changer?
It was really more what was happening on a daily basis. We were fortunate enough to be able to connect with Dr. Murphy's center at Hopewell and actually bring mental health staff into the Walbridge School. It was a matter of we can bring these staff on, how do they connect with the social services, with the health services, and with the school staff. Just having you bring in an additional 4 or 5 people into a school, and where do they even sit? Where do they go? Where are they housed? Little things like that that had to be worked out.
Help us understand why this made sense and mattered through that mental health lens that you worked for and others were determined to see implemented in our school systems.
In my opinion, having services at the school was really a very good idea. Parents were trying to overcome all kinds of obstacles of transportation. Transportation ended up being one of the biggest issues that every community dealt with, whether it was a rural community or an urban community. Transportation was the single most important issue that I remember each community faced. But then there were costs, there was time off from work, there were just things like that, that bringing services to the school, it made it so much easier for families to try to negotiate getting those services. Bringing social services to the school made so much more sense. People didn't have to try to get on a bus. There's a social service agency in every county in the state. You have to go to them for eligibility. You have to go to them to find out where you get help from. Health services were the same way. You can go to a health center, but you have to go there. But if you just go to school, there are the services right there. It made so much sense.